Hey, what's going on? My name is Dr. Isang. So today I'm going to be talking about one of the most common things that people come to me for, which is palpitations, both in the hospital and outside of the hospital. So what exactly is palpitations? It's an abnormal sensation that you're feeling. You can actually have palpitations and have a normal rhythm. You can have a palpitation and have abnormal rhythms. So how do we further investigate this? The first thing is going to be an EKG, an electrocardiogram. So what this does is it looks at what your rhythm is doing currently. Unfortunately, this sometimes can be helpful, sometimes not, because people's palpitations differ from person to person. Someone can have palpitations consistently, so an EKG may capture it, but in reality, some people have it for a few seconds, few minutes, and then it goes away, comes back later that day or later that week, later that month. Depending on how frequent it's occurring leads to our next step, being a Holter monitor. And the Holter monitor, sometimes you can watch it for 24, 48 hours, upwards to 3 days. If that's not successful, then we have longer monitors that can go anywhere from 7 days upwards to 30 days to really figure out what's going on. There are some people who, unfortunately, despite having all these monitoring testings, it doesn't show anything. So what do we do next? We look at the history a little bit deeper. We look at potential triggers for these palpitations, things like excess caffeine, excess energy drinks, low potassium, high potassium, low magnesium, looking at vitamins and nutrients or the deficiencies that are associated with it. If we find that people are still having symptoms despite correcting everything, so we can look at potentially doing a longer monitor, a loop recorder. The benefit of this is that it can last anyway upwards to 1 year, 1 year plus, so that if it's occurring very rarely, that we capture it. A lot of times I do find that people's symptoms do not correlate with the electrocardiogram when they have the monitors on. So we have to look at life stressors. All of them are going through a lot of stress in their life, leading to poor nutrition, poor sleeping habits, and developing other bad habits such as smoking, such as finding other ways and drugs to alleviate some of their symptoms temporarily. So it's a holistic approach in getting a good history, a good physical, getting labs, getting an EKG, Holter monitor, loop recorder, etc. to finally figure it out. There are medications for palpitations, specifically beta blockers, something like a metoprolol. A lot of times I try to not use that initially and look at the things that we can do, reducing caffeine, reducing stress, increasing our sleep, reducing the bad medications that we're taking, bad drugs. And if that's not successful, then we'll look at beta blockers. I always want to give them a caveat that some of these medications may make you feel worse than the palpitations itself. One of the biggest adverse effects of beta blockers includes fatigue, not really wanting to do anything, tiredness, weight gain. So just be cautious when starting those new medications, that you know both the benefits and the risk of those medications. But it's always important to follow up with your primary care, follow up with your physician for continual evaluation as to what the cause of your palpitations is. And then number 2, can you do without being on medications, or are the palpitations really bad that you need to be on those medications to help control it a little bit better? Now, in our next topic, we're going to be talking about specific types of palpitations, the ones that may need to be on medications more than not. Things like SVT, PODS, and inappropriate sinus tachycardia are all in the umbrella of palpitations. If you find any benefit in this, hit that subscribe button.